The information provided in this video is for educational resources only. It is not intended to serve as a recommendation for the treatment or management of any medical condition. During pregnancy, you may experience difficulty finding a comfortable sleeping position due to back, hip, belly, or pelvic pain. In this video, you will be shown positioning techniques and use of pillows to improve your quality of sleep, decrease pain and pressure, and support your body. You will also be shown different sitting and standing positions to help transition when you're in pain. If you experience low back pain while sleeping, elevate your head and trunk with pillows up to 5 or 6 underneath your head and your shoulders, or a wedge to prop yourself up into a semi-reclined position. Placing pillows under your knees can also relieve the pressure in your low back. You can place pillows under your elbows if needed for support through your arms and shoulders. A wedge will be available at prosthetics if needed to help with sleep quality and improving pain management. Another complaint women have during pregnancy is that they'll experience pain when they're moving from lying down to sitting, or they're rolling from one side to the other side in a bed. When you're moving from a lying down or side-lying position to a sitting position, I want you to keep your legs together, come towards the edge of the bed, and then as you drop your legs down, use your upper body and your arms to push you up at the same time. This can allow support through the pelvis and the hips and low back. You can also do that when you're about to go to bed as well. So use your arms to support as you lower yourself down, and then lift your legs up, keeping your knees together. If you're moving from one side of the bed and rolling to the other side, I want you to keep your knees together, and I want you to turn over to your back in one motion. Good. And then you'd continue to roll using that same motion, keeping those knees together and rolling as one unit through your spine. During or following pregnancy, you may experience pain when you move from sitting to standing, rolling in bed, or getting in and out of the car. During this video, you'll be shown how to use your abdominal muscles and your pelvic floor muscles to help support your pelvis as you move throughout your day. The transverse abdominal muscle is the deepest layer of the abdomen, and it acts like a corset to provide stability to your spine and pelvis. It attaches from the sternum and ribs to the pelvis and spine. When you contract this muscle, it should feel as if your lower abdomen is tightening, as if you're trying to button jeans that are too tight. So when we're performing this, I will have you start with an inhale. As you exhale, draw the belly button towards your spine, allowing for a tightening and lift of the lower belly. To tell if you're doing this correctly, place your hands on your hip bones and feel the muscles tighten under your fingers. So the process would be inhale, exhale as you tighten, as if you're feeling a lift of your lower belly. If you feel like you're flexing forward or your rib cage is bulging to the sides, you're giving me a little too much activation. This tightening should be about 30 to 50% of what you expect. You should still be able to move and perform your activities while tightening. You can perform this contraction along with all of your exercises and movements, including rolling from side to side in bed, and also going from a lying down position to sitting position. We'll also incorporate it with other movements as we learn them. The other component to good pelvic support is using your pelvic floor muscles for a contraction, otherwise known as a Kegel. When you're doing a Kegel, what I'd like you to do is inhale, and as you're exhaling, I want you to tighten or squeeze as if you're trying to stop the flow of urine or trying to stop from passing gas. You shouldn't be able to tell that you're doing a Kegel from outside observation. So there should be a gentle lift between your anal opening and your vaginal opening. I want you to squeeze and hold on the exhale for 3 seconds. If you're using your glutes or feel yourself lifting off the chair or squeezing your adductors, you're just trying a little too hard. I want you to back off how hard you're trying to squeeze and really feel the isolation between your legs. Women who are sitting for long periods of time or have a job that requires sitting will report pain in their buttocks, in their pelvis, and sometimes in their pubic bone. For proper support, try to sit with your knees at a 90-degree angle, your feet supported on the floor, and then what's called pelvic neutral. So your pelvis shouldn't be tilting forward, arching your back. You shouldn't be slumped backwards in your chair, creating strain on the back. So try to find your sit bones and create a neutral position where your pelvis isn't tilting. If you need support, you can use a rolled up towel and place on the lower part of your back to allow for that rest while staying in that pelvic neutral position. Try not to lean to one side or cross your legs, as this will increase strain on the muscles in your back and hips. From sitting to standing, I want you to use that TA contraction that we just learned and a Kegel, and I want you to place your weight evenly through your legs as you lean forward to stand up. Kegel tummy and stand up with an exhale. Even weight distribution through your legs. Same with sitting. I want you to Kegel and use your TA and then sit back down. Reach for the chair if you need it. If you need to stand throughout your day, it's important to look at your posture. I need you to try to evenly disperse your weight between your legs and your feet. I want you to look at your toes. Make sure they're pointing forward and one's not out to the side. You should feel the weight in your heels and mid-foot versus your toes. As you move up from your feet, look at your knees. Make sure that they're soft and not locked. And then we go up to your pelvis. Make sure that your belly's not pulling you forward and your hips are stacked underneath of your rib cage. If your bottom is sticking out, to try to decrease the strain on your low back, tuck your buttocks in just a little bit, allowing for a natural curvature in your spine. Going up from your rib cage stacked underneath your pelvis, look at your shoulders, make sure they're relaxed. And in the down back position, having those shoulder blades slide down your back. Your neck and your chin and your head should be in a line with your spine. Your neck and chin shouldn't be poking out in front of you, but tucked in slightly. Okay, again, looking at your back, make sure your legs are straight, your toes are pointing forward, that pelvis isn't tipping back or front. There we go. And the shoulder blades are nice, rested backwards towards your back pockets. Looking at your shoulders, make sure that they're not up towards your ear or that they're not rolled forward, that they're just resting gently down and back. This can take some getting used to. It's awkward in the beginning for people to change their posture, but this will allow for improved support throughout your body. When walking, it is common to hear about the pregnancy waddle when you're shifting from side to side, which can increase the strain on your pelvis and your muscles. To decrease the amount of sway from side to side, start with your toes pointing forward and shift the weight from your heel, pushing off into your toes as you're walking, making sure to engage your buttocks with every step, which will allow for that extra support. You should see an up and down motion when you walk instead of a side to side motion, squeezing those glutes. When you get in and out of the car, most people use one leg to stand up on. But for pain management, swing both legs out of the car, use your even weight bearing strategy, push yourself up, standing up using your stomach for bracing. When you sit back down in the car, face your buttocks towards the seat, use your arms to lower you down, weight bearing evenly through the legs, and then bringing both legs into the car at the same time. This will create pelvic stability and will improve support into your lumbopelvic region.